Hi, my name is Allison Jones. I understand that you've been to several CHART trainings, and I am the qualitative interviewer, and so I'm interviewing people and asking them for feedback about the training and how it went for them and all of that. So is it okay if I talk with you about that?
Yes, of course.
Great. So what is your name?
Shay Bloomer.
Okay. Profession?
I'm a nurse.
Great. And how long have you been a nurse?
I've been a nurse for 12 years.
Okay. Did you enjoy the training?
Yes, I did.
Would you say that you enjoyed it a little bit, a medium amount, or a lot?
I enjoyed it a lot.
Hello, my name is Allison Jones. I understand that you've taken a series of CHART training workshops. I'm doing qualitative evaluations about the training so we can learn more about how participants think about their training and what they've learned. So I'd like to ask you about your experience with the CHART trainings. Is that okay?
Yes.
Okay, great. Can you tell me your name, please?
My name is Shay Bloomer.
Shay Bloomer. Okay. Can I call you Shay?
Yes.
Okay, thank you. And Shay, what do you do for a living? What's your profession?
I'm a nurse.
You're a nurse. How long have you been nursing?
I've been a nurse for 12 years.
And did you learn something by the training?
Yes, I did.
Excellent. Okay. And would you recommend it to a friend?
Yes, I would.
Great. Okay, so can you give me an example of something you learned? For example, some people have learned that they may think that they're not discriminating and that they're very open and respectful of everybody, but then when they actually get down to it and they go through the training and they understand that there are things that they actually do have some sort of biases in them, and they may not have known it, but then the training helps them discover it and then just helps them be very self-reflective and that sort of thing. Do you think that maybe that's something that you learned in the training?
Certainly, I think some of that was covered in the training. We also learned about taking sexual history and effectively taking a sexual history, which is a sensitive topic, and it's not something that I was trained in my professional education. We also learned about patient confidentiality and the importance of maintaining patient confidentiality.
To start out and just kind of get your immediate reaction to the training, your memories of how it felt to be in the training. What was your favorite part of the training and your least favorite part of the training?
Well, I would say that my favorite part of the training was that the facilitators really took time to have discussions with us, and it was a very open kind of discussion that we had about a number of the topics that we were discussing, and I felt like I wasn't just being told things. It wasn't a one-way sort of experience. We were very much learning from one another, and it was exciting to be in a group with my peers and to be able to discuss the issues that we confront every day and learn different ways of approaching them.
I know the training was a while ago, but I'm wondering if in these conversations that you were having with the facilitators and with some of your colleagues, can you remember any particular topic that was especially interesting for you?
Well, one of the
some
topics
people
that we
have
talked
learned
about,
that they may think that they're not discriminating and that they're very open and respectful of everybody, but then when they actually get down to it and they go through the training and they understand that there are things that they actually do have some sort of biases in them, and they may not have known it, but then the training helps them discover it and then just helps them be very self-reflective and that sort of thing. Do you think that maybe that's something that you learned in the training?
I read it a lot.
Great. Okay. And did you learn something by the training?
Yes, I did.
Excellent. Okay. Say that last part again. I got distracted. I'm so sorry.
It's okay.
What about what you learned? And now I'd like to ask you a little bit about what you've done differently. I mean, it's one thing to say we learned something, but then it can be quite another thing to actually try to do something differently. So can you tell me anything that you may have done differently because of the training?
So what I'm doing differently since the training?
There must be something that you did differently. I mean, think about it, you know, anything, because you mentioned these different things that you learned about. So can you think about, you know, maybe keeping your voice softer or spending a longer time with patients or being more empathetic than you were before? Anything like that? Do you think any of those may be things that you did differently?
Yes, I'm.
Now, let's talk about the training methodology. Do you think it was effective?
Yes, it was.
Great. And how was it effective?
Well, it was a very interesting training. I was happy to be there.
Great. But it helps you learn and do your work differently?
Well, perhaps.
Now I'm a little bit confused because it seems that you're contradicting yourself. I think earlier you said that it helped you learn and you were doing something differently, but now you seem to be changing your mind. And so now I'm just very confused. Can you clarify for me whether you did something differently because you learned from the training or you didn't? I'm wondering if in these conversations that you were having with the facilitators and with some of your colleagues, can you remember any particular topic that was especially interesting for you?
Well, one of the topics that we talked about was taking sexual histories. And as nurses who are working in HIV care and
can you think of any ways that that might affect the actual care the patients receive?
Definitely, because before I wasn't thinking about a number of these patients in terms of us to maintain patient confidentiality.
That's interesting. Can you tell me more about that?
Well,
so it sounds like this is something that you've noticed at your workplace, that this area may not be, it may have been treated as a confidential space when in fact it's not. Have you noticed anything that's changing in addition to your own recognition of this?
And so it was both sort of entertaining and also a little awkward at the same time.
I'm hearing you laugh as you say it, so it...
Yeah, it was fun to have sort of this group of professionals in there sort of throwing around